What is OCD? Its many faces. The people you will meet in this chapter are representative of the millions of people who have obsessive-compulsive disorder, or OCD. They struggle with a neurobehavioral disorder that fills their minds with unwanted thoughts and threatens them with doom if they don't perform repetitive, senseless rituals. They are not a rare group. About 1 in 40 people has OCD. In the Diagnostic and Statistical Manual of Mental Disorders, American Psychiatric Association 2000, obsessive-compulsive disorder is placed within the class of psychiatric disorders known as anxiety disorders. Other anxiety disorders include panic disorder, social phobia, simple phobia, generalized anxiety disorder, and post-traumatic stress disorder. OCD is characterized by obsessions and/or compulsions that are time-consuming, distressing, and/or interfere with normal routines, relationships, or daily functioning. Obsessions are persistent, unwanted thoughts, images, or urges that intrude into a person's thinking and cause excessive worry and anxiety. Compulsions are covert mental acts or overt behaviors performed repetitively to relieve or prevent the worry or anxiety generated by the obsession. They often have the intent of magically preventing or avoiding some dreaded event, such as death, illness, or some other perceived misfortune. Forms of OCD. OCD has many faces, but the patterns of thoughts and behaviors of people with the disorder are remarkably and unmistakably consistent. The most common symptoms associated with OCD are checking, washing and cleaning, ordering and repeating, hoarding, and scrupulosity. Some people who suffer from OCD don't seem to engage in these behaviors, at least not overtly. This is known as primarily obsessional OCD. Checking. Those who engage in checking live with an excessive, irrational sense of being held responsible for possible dangers and catastrophes that may befall themselves or others as a result of their imperfect, incomplete, or careless actions. They feel compelled to repeatedly check that, for example, doors and windows are locked, the stove and iron are turned off, the coffee maker is unplugged, or the garage door is down. They will check over and over until they get a just right feeling, or a sense of assurance that disaster will be averted. They might also repeatedly check on loved ones to make sure they haven't caused harm to them. Checking compulsions also occur within the context of health-related obsessions, for example, repeatedly checking one's heart rate or blood pressure for evidence of abnormalities that could signify the presence of a catastrophic illness. Checking relieves the anxiety brought on by the obsessive thoughts, but the relief is short-lived. The worries often return or are replaced by similar obsessive thoughts, calling for more checking. A vicious cycle is thus created, anxiety followed by checking, which results in limited relief, then a return of the anxiety, followed by even more checking, and on and on. Washing and cleaning. People who wash and clean excessively have obsessions about the possibility of contamination by dirt, germs, viruses, or foreign substances. They live with a near-constant dread of either causing harm to others or to themselves, or failing to prevent it. In response to their fear-provoking thoughts, they excessively wash their hands, shower, or clean their homes for hours on end. Over time, fears compound as they perceive more possibilities for harm. The washing and cleaning become more and more elaborate, and yet bring less and less relief. Ordering and repeating. Those who engage in ordering and cleaning might feel they must arrange certain items in a particular, exact, perfect way, or they might repeat particular actions over and over until they feel just right. Many demand that particular objects, such as their shoelaces, hair, or personal belongings, be perfectly even or symmetrical. They become extremely distressed if their things are moved, touched, or rearranged even slightly. Obsessive thoughts or fears of harm coming to them, or a loved one can lead to a frenzy of ordering, or repeating certain behaviors over and over. They might cross over a room threshold repeatedly, count or repeat words silently, rearrange items, or turn light switches on and off until it feels just right. Only then will the obsessive thoughts or fears subside, if only for a few moments. Scrupulosity. People with scrupulosity obsess about religious, ethical, or moral issues. They demand a code of conduct from themselves that goes well beyond that of most people who subscribe to their beliefs. Their compulsions may involve excessive praying and repeatedly, needlessly seeking reassurance of their moral purity from others, usually priests, ministers, or rabbis. Rather than providing peace and freedom from the anxiety, these compulsions actually bring on even more anxiety, as the OCD demands more perfect adherence to religious rules and practices, triggers even more reassurance seeking, and leads to other rituals to relieve the doubts. Hoarding. Those with hoarding collect insignificant items, and have difficulty throwing away things that most people would consider junk. They develop a strong attachment to their hoarded items and overvalue their importance. Often they are afraid they might need the items at some vague time in the distant future. For these people, letting go of things can cause so much distress that it's easier just to keep them. This results in chaotic and unbearable living conditions, in which there is little usable space in the house that isn't taken up with junk.